next step is to prep the patient's skin so we can ensure good adherence of the electrodes and a clean signal coming through on our telemetry. So we'll remove the patient's gown, peeling back only as much as we need to. We have to be able to expose the skin so that we can prep it as well as apply the electrodes. The first thing we'll do is put some warm water and a little bit of soap into our basin. We're going to lather up our cloth and we're going to clean off the patient's skin. Now, if you have a patient that has a lot of hair, we're going to clip the skin using clippers, not a razor, to remove any hair where the electrodes are going to be placed. So remembering your placement, you're going to be putting a lead up here, 2 below the rib cage, and then depending on what kind of incisions or dressings your patient has on their chest, we're either going to put B1 on their chest here, or we're going to revert over to B6, which is on the left side. So just try and figure out where exactly those leads will go. We'll talk about placement after we talk about our preparation. We'll take our warm water and our soap, and we're going to clean off our area that the lead is going to go. After that, we're going to take our dry cloth and dry the area very well, as well as just do a little roughing up of the skin just to remove any dead skin cells and allow for better transmission through the gel to the telemetry pack. We'll continue in the same manner, doing all of our spots where our leads are going to go. We want to make sure that we avoid the use of alcohol. What happens when we use alcohol is it dries out the skin, and it also dries out the gel when the gel is placed against it, and it can decrease our signal transmission coming through to our telemetry box. We also don't want to use any of the barrier film. Although it does help with tackiness and allowing the leads to stick a little bit better, it actually can put a barrier between the electrode and the patient's skin, which is going to decrease our signal transmission, something that we don't want to have happen. When we go to place our leads, we need to be palpating the patient's skin in the spot that we're placing them. It needs to go on skin that is nice and soft. We don't want to place it over a bony prominence. We don't want to place it over any scars or dressings or any incisions on the patient's body. So we need to ensure that the placement is appropriate over the right tissues so that we get the right transmission of the signal. Next, we'll talk about lead placement.